Tobacco Addiction by Lil Maria Santos. Cigarette smoke is the leading cause of preventable death in the United States. There is a 20.6% of actively smoking adults. Smokers who quit generally relapse after a year. 70 to 90% of smokers resume smoking within this year. It is predicted that if the current rate continues, 10 million people will die per year due to cigarette smoke by the year 2025. There are a lot of consequences to cigarette smoke for your health, including coronary heart disease, stroke, chronic obstructive pulmonary disease, peripheral vascular disease, peptic ulcer disease, and lung cancer. Smoking has been also found to cause many other types of cancer, including cancer to the oral cavity, esophagus, stomach, liver, pancreas, nasal cavity, nasal sinuses, bladder, kidney, cervix, even leukemia, among other types of cancer. So this is a very concerning issue. It has been linked or considered a disease pretty much because it is really hard for smokers to quit. There are 3 types of smokers. We have the first-hand smoker, which is the active smoker, the person who actually smokes a cigarette. We have the second-hand smoker, which is the passive smoker, the person who inhales the second-hand fumes from the cigarette smoke. And then we have the third-hand smoker, which is a concept that I just recently learned. It is a passive smoker. This person is not exposed to the fumes. This person is only exposed to the toxins left on surfaces where previously somebody smoked a cigarette. So, for example, having somebody smoke in a hotel room, the smoking is no longer present, but the toxins are left on surfaces. The first-hand smoker, the active smoker. Right now, 1.2 million lung cancer patients die each year because of cigarette smoke. There are behavioral medical quitting strategies, but they do not help 80 to 86% of the smokers who attempt to quit. The relapse after quitting cigarette smoking for more than 2 weeks are not correlated with nicotine withdrawal symptoms. They are basically correlated with behavioral cues from the environment, such as maybe an area, another substance, many different environmental cues. There are stressors that also constitute to people wanting to smoke after being abstinent. Secondhand smokers. Secondhand smokers are people exposed to inhaling smoke or contaminated fumes from people who smoke. So, as found in a study by Ceylon in 2014, people who were exposed to cigarette smoke were checked, I guess. They measure their carbon monoxide when they exhale, and it matched exactly to an active smoker. So by being exposed to secondhand smoke, you're basically smoking yourself. Exposure to secondhand smoke has also been correlated to lung cancer. Third-hand smoker. Now, this has not been researched enough to know if it has a major impact on health, but it is a concern for kids who are most exposed to surfaces where the lingering toxins of cigarette might be at. For example, in a car where somebody smokes, the toxins stay in the material of the seats, and kids are more exposed to touching such materials and having effects such as allergies or asthma-related symptoms. There was a major study with mice, and it was found that exposure to third-hand smoke correlated to increase in insulin resistance. So it could also be correlated to some sort of diabetes. Nicotine effects on the brain. Now, nicotine, it is processed through the mesolimbic system. It induces dopamine release. This means that it's very correlated towards areas of your brain that induce pleasure. So, smoking a cigarette might induce pleasure within the context of where you're smoking the cigarette. Now, nicotine effects on the brain also causes negative feelings such as nausea, cough, and dizziness. But the more you expose yourself to inhalation of nicotine, your tolerance builds up. Now, low levels of nicotine has been correlated with adverse symptoms. Now, this is the thing. The higher the level of nicotine, the more it has been correlated to dopamine release and activation of brain areas that are correlated with pleasure. There are many non-biological factors of smoking. Nicotine activates the pleasure areas of the brain. Now, there are environmental cues. Maybe the area where you smoke, or the smell of the cigarette, or maybe other factors that you connect to cigarette smoke, such as caffeine or alcohol consumption. Now, in Fokker 2018, there was a correlation between women and this psychological cues. Men were really correlated with the nicotine consumption of the cigarette, while women were more affected by the psychological factors. The withdrawal symptoms expressed by women were even more focused on the psychological factors. They even placed the women with two different types of cigarette, one with low nicotine percentage in it, the other one with a little bit of higher, and they couldn't tell them apart. Both of them were satisfying. So maybe the smell of cigarette or the action of actually smoking was more reinforcing than the actual nicotine in the cigarette. There are many public intervention strategies in place. There are public awareness of the negative effects of tobacco through media, through many different types of ways. There are also non-smoking policies in many public areas, which are placed in order to reduce smoking behavior. The less available it is, or the less comfortable areas might be for smokers, the best or the least chances they have of smoking. Now, there has also been correlated increase in taxes on tobacco products has reduced the number of cigarettes smoked per day. Nicotine withdrawal symptoms. People have reported anxiousness, irritability, frustration, reduced attention, increase in appetite. Now, increase in appetite has been very concerning because people who quit smoking are concerned with weight gain. There has been many studies on this, and it shows an average weight gain of 8 to 10 pounds within the first year of quitting smoking. There are a number of quitting strategies. Nicotine replacement therapy, such as patches, nicotine gum, and others. It has been studied through fMRI in Lieberman 2014, and it showed results that areas involved in craving of cigarettes was less active when nicotine patches was present. There's also a pharmaceutical therapy of varenicline, which is a partial agonist. Now, this drug it attempts to block the binding of nicotine and neurotransmitter receptors in the brain. Now, this is supposed to partially reduce the feeling of pleasure when you smoke. Other strategies focus on behavior interventions, such as motivation and social support to quit smoking. A lot of information on negative effects of smoking and the positive effects of quitting, helping smokers to set up a quitting date, and teaching basic skills on how to cope with social cues, how to cope with cravings, and other stuff. Now, a combination of some sort of behavior therapy and medication has been proven more effective in preventing relapses. Why? Medication has been proven effective within 2 weeks after quitting. After that, all relapses have been correlated to behavioral cues, to environmental cues. So behavior therapy is really very effective in attempting to keep smokers from relapsing, from returning or being able to cope with cravings or social cues. For example, drinking a cup of coffee and not wanting a cigarette. Now, the combination of both of these therapies are very hard because smokers usually attempt to quit and they relapse and they kind of give up on the whole ordeal. It takes many times, many attempts to quit for a smoker to actually report quitting. Now, smoking is a very concerning issue because of all the information that is out there on the negative effects, on the amount of death it causes a year, and the fact that the number of people quitting has not lowered enough. Now, here are a list of all the references I used for this presentation. You are welcome to look at them. There are a few research on different topics, and you are